I'm presenting about estimating the cost of cancer care in a low research setting, and I'm using time-driven activity-based costing approach to estimate the cost in a low research setting, and I've taken Nepal as a case example. So in this study, we have tried to estimate the cost by using the TDABC approach. So from the name, you can understand that it is a time-driven activity-based costing. So basically, in this approach, we take two things into consideration. The first thing is the process map for the service utilization process for different cancers, and then we estimate the resource use. For example, we estimate the cost of providing cancer care, like on human resource perspective, and also the cost of equipment, the cost of infrastructures, and the cost of indirect cost. Yeah. Well, the major outcome of this study is that we'll be able to obtain unit cost of providing cancer interventions for different types of cancers. So basically, the process that we employed is the USC compendium package proposed by the World Health Organizations. So from this USC compendium, we get different interventions for different types of cancers. So from that, we calculate the resource use for providing each of these interventions. So basically, when we obtain this unit cost, we'll be able to utilize these informations as an input for cost effectiveness analysis, and which is also the another objective of this study. Okay, before going into the major results of this study or the major outcomes of this study, let me tell you one thing is that we are trying to utilize fair choices, a modeling tool developed by the University of Bergen and which has been recognized by the WHO for designing health benefit package for cancer intervention for different interventions, including cancer. So the major outcome would be the unit cost for providing cancer care, which could be, although this study is based in Nepal, this could be a reference for other low and middle income countries so that the policymakers, the decision makers can allocate the resources, they can allocate what resources are required for delivering cancer care. Moreover, it also helps in the estimations of resource required for providing cancer care, and also it can be used as an evidence to inform scaling up of cancer services in different parts of the country. Well, regarding this topic, I think this approach, the TDABC approach, is a very useful approach. It's because it closely estimates the cost of cancer care. It tracks the patient's journey of taking services in a hospital setting. So the importance is that it closely estimates the cost of cancer care, and moreover, the other importance of this particular method is that it gives you a rich evidence of data which can be utilized for allocating the scarce resources that the resource constraint settings have. So it is basically a tool to empower the cancer stakeholders to allocate the resources and also to negotiate with the decision makers about, like, okay, this much of resources is required. And the other thing is that it also gives you information about the health system inefficiencies. For example, there might be long waiting lines, there might be underutilized equipments, and there might be other things where resources can be reallocated to different care process. So basically, it is also about improving health system efficiencies, which can again save resources, which can be utilized to provide cost-effective cancer services.